Welcome to Getting Understanding with Dr. Darrell Ellis. As usual, I'm your host, Dr. Darrell Ellis. I want to check back in with you about some things. We've been talking about COVID-19, talking about vaccinations, talking about possible ways that we can practice prevention in addition to vaccinations with respect to social distancing, mask wearing, sanitization, all of the things that have been recommended by the FDA and the CDC to not only help us to stay healthy, but also if we were to get infected, to try and keep us from having significant morbidity or mortality, meaning getting sick to the point where we require hospitalization, and once hospitalized, hopefully not get so sick that you require mechanical ventilation or being on the ventilator that would put you at increased risk for death. We've been talking about that for quite a few videos now, and I'm here today to share some good news with you. The good news is that this last surge that we've been experiencing with the Delta variant, at least here in the southeast United States where I practice and where I live, is starting to wane. We're seeing hospitalizations go down. We're seeing immunization rates go up, although very slowly, and it's all very encouraging. But I don't want people to take that for granted. We're just getting to the point of the year where the seasons are about to change, where we go from the warm fall months here in the southeast to where it's going to start getting a little bit cold. And as that happens, people are going to be gathering inside more and more. As we enter into the holiday season also, we're going to see larger groups of families getting together in indoor environments where they will or will not necessarily be able to practice social distancing, where they likely will not be wearing their masks. Some people, particularly those of us who have been immunized, have a false sense of security that because I've been immunized, I don't really need to wear a mask. There's no risk that I'm going to get sick, so why should I wear a mask? Well, the truth is that even though we're immunized, we can still spread the virus if we contract it, whether we are symptomatic or asymptomatic. And if we're around other family members who either were not immunized and or did not get a good immune response because they have an underlying immunodeficiency, they can become very sick. So we still need to practice safety first. Wear your mask whenever you can't social distance. Whenever you're in large groups and indoor gatherings, try to wear your masks. Make sure you're continuing to do frequent hand washing and hand sanitization. And just be as careful as you possibly can. That's just a tip from me to you. Also, I wanted to discuss the booster vaccines. If you received the Pfizer vaccine, the mRNA vaccine that was produced by Pfizer, they are now at a point where they're offering booster vaccines for selected groups of the population. And those are the same groups that were considered to be at highest risk when we initially rolled out the vaccinations. That would be people over the age of 65 and or people who have comorbid medical conditions. Well, what is that? Diabetes, hypertension, heart disease, chronic lung disease, obesity with body mass index over 30 kilogram per meter squared. If you're overweight or if you have chronic medical conditions and if you're over 65 and if you're a frontline worker, someone who works directly with patients who have COVID-19 and or at risk for COVID-19, you should get your booster vaccine. If it's been more than 6 months since your second dose, then you're eligible for that booster. One of the questions that I've gotten over the YouTube channel is that should you get the booster vaccine and the flu vaccine at the same time? Well, there are certain areas, particularly some of the health departments, who are recommending and saying that yes, you can get them both at the same time. And although that may be safe, I don't think it's wise. The reason why I say that is because much of what we've seen in terms of pushback for getting vaccinated are the side effects associated with the vaccines. People get body aches, they can have low-grade fevers, they can have increased fatigue. Those are the same kind of side effects you can get with an influenza vaccine. And if you're taking them both at the same time and you start having some significant side effects, it can be an additive side effect profile from the two taken together. My recommendation is that although you need to be vaccinated for both, that you try and separate them by a couple of weeks. That way you get one, you're able to work through those side effects that usually only last a couple of days, then you can go ahead and get the other one. That's just the word to the wise. Once you are vaccinated, taking Tylenol for those side effects usually is quite effective. Make sure that you're hydrating well and try and get plenty of rest, and you'll do just fine. So those are my tips for you today.